Hello, my name is Erin Woodfield, and this is my skin cancer prevention tutorial for the University of Phoenix, Class AET 545. The skin is the largest organ in the body. It protects us from heat, light, injury, and infection. A good understanding of sunscreens to prevent burns can help reduce your risk of skin cancer. The skin is made up of two layers, epidermis and dermis. The epidermis is the outer layer of the skin that is made up of scale-like cells called squamous cells. Within the epidermis are squamous cells. Underneath contain basal cells. The three most common types of skin cancer are squamous cell carcinoma, basal cell carcinoma, and melanoma. Risk factors. Ultraviolet B rays cause the most damage, including wrinkling. Ultraviolet A rays suppress the immune system. Artificial sources such as indoor tanning lamps also have a dangerous effect on the skin. Risk factors also include sunburns, blistering sunburns in childhood and teenage years, fair skin, freckles, moles, family history, and exposure to sun between 10 a.m. to 4 p.m. when it is the strongest. Indoor tanning. People who begin tanning younger than age 35 have a 75% higher risk of melanoma. Using tanning beds also increase the risk of wrinkles, eye damage, and changes skin texture. Prevention. A sunscreen's effectiveness in protecting the skin from UV rays is expressed as the sun's protection factor, SPF. SPF is a ratio of skin protection using sunscreen compared to not using sunscreen. This is determined by how much time a person can be exposed to UV rays before the first perceptible redness of burn. Prevention. Sun protection factor is determined by how much a person can be exposed to UV rays before the first sign of redness occurs. For example, a person who normally experiences sunburn within 20 minutes of sun exposure could expect to extend this time period to 200 minutes with an SPF of just 10. Signs and symptoms that are definite but not limited are moles changing in color, size, height, and thickness, an open sore that does not heal within 3 weeks, and a spot that continues to itch, bleed, or scab. Wearing sunscreen is important. Apply at least 30 minutes before sun exposure. Choose waterproof or sweatproof. Apply generously, and reapply every 2 hours, even when cloudy. Assessment. Number 1. List the 3 most common forms of skin cancer. 2. What are the 2 dangers to indoor tanning? 3. If someone can expect to burn in 30 minutes, how long will they be able to avoid sunburn with an SPF of 30? 4. Name 4 symptoms of skin cancer. 5. What type of cells does the skin contain? And 6. Name 3 prevention strategies for skin cancer. Thank you for viewing this tutorial. I hope you have learned to make informed decisions on sun protection. Please feel free to include your feedback.